Minoxidil is probably the most researched term by hair loss sufferers on the internet. Those who are concerned about their hair loss are either on minoxidil or on a DHT blocker. How are these two medications different from one another? What are the side effects of these two medications? How often should I apply minoxidil? How should I apply minoxidil? And in what concentration should I apply minoxidil? If you have any of these questions troubling you, I, Dr. Akanksha Bhatti, am here to clear all your doubts in this video. So stay right there. Minoxidil is a well-known hair growth stimulant. It is an arteriolar vasodilator which acts specifically to open potassium channels. Back in the 1970s, it was first implemented as an oral medication for the treatment of hypertension. Interestingly, it was found that those who took minoxidil ended up having a common side effect, which was hypertrichosis or an excessive growth of unwanted hair in the body. This side effect also occurred in children. So once the doctors started discovering this, they thought about using minoxidil for the treatment of different forms of hair loss. Oral minoxidil did in fact reverse androgenetic alopecia, but it ended up having certain unsafe and unpleasant side effects such as water retention, weight gain, and even a drop in blood pressure or hypotension. As of now, there are two formulations of topical minoxidil present in the market. The first one is the solution form and the second is the foam. Minoxidil sulfate is the active metabolite of minoxidil that stimulates hair follicles. The conversion of minoxidil to minoxidil sulfate occurs through a reaction which is catalyzed by an enzyme called sulfotransferase. This sulfotransferase enzyme is present in the outer root sheath of the hair follicles, and the levels of this enzyme can vary from person to person, just like the levels of DHT in the scalp can vary from person to person. It has been found that those who have a higher level of this enzyme in the hair follicles end up having a better response to topical minoxidil. Minoxidil dilates the blood vessels in the scalp, hence improving the blood flow to the scalp. This results in faster hair growth, an increased number of hair in the anagen phase of the hair cycle, decreased number of hair in the telogen phase, and the hair shafts also end up becoming thicker, giving a voluminous look. Lastly, minoxidil has also shown to have certain immunoregulatory effects on the hair follicles. Minoxidil suppresses the activity of T lymphocytes, which are the main culprits of a condition known as alopecia areata. Alopecia areata is an autoimmune form of hair loss which presents as multiple bald patches all over the head. As a hair transplant cannot be done in those who suffer from this condition and are in the active stage of this disease, they can really benefit from the application of topical minoxidil. Today, 5% minoxidil solution or 5% minoxidil foam is used for treating hair loss in men. As women are more apprehensive about the excessive hair growth around the face, they are first started on 2% minoxidil. Sometimes some patients might encounter certain side effects such as itching, burning, or even redness around the areas where they apply minoxidil. These side effects occur due to the presence of propylene glycol, which is an irritant which is present in the solution form of minoxidil. To avoid these side effects, patients are advised to switch to the foam form of minoxidil or to even ensure that they wash their hands after each application. I restrict the frequency of application of minoxidil to once a day at bedtime so that the patients are more compliant to the medication, as certain patients might feel that their scalp skin shows more because the minoxidil solution or foam ends up making their hair more greasy during the day. Also, applying minoxidil at night forms a routine, and the patients make sure that they end up applying minoxidil and they do not forget it. There are certain contraindications for the application of minoxidil which should always be kept in mind. Patients who've had a cardiac arrest in the past, who have undergone a cardiac surgery in the past, or those who have any other cardiac conditions should not be applying minoxidil as it might end up causing arrhythmias and might be unsafe for you. Secondly, women who are pregnant or are breastfeeding should not apply minoxidil at all as minoxidil tends to accumulate into lipids and it might end up accumulating into the fetal brain. This might lead to fetal malformations. So, women who are planning to get pregnant or are breastfeeding should ensure that they've delivered the child and stop breastfeeding so that they can apply minoxidil later in the future. A common phenomena which is seen in those who apply topical minoxidil is that within the initial 3 to 4 weeks of application, they end up having hair fall and become apprehensive. What you should know is that this is actually a good sign that minoxidil is actually working as the telogen hair, which is the weak hair, starts falling off and the stronger hair is soon going to come out. So before I prescribe minoxidil, I always explain to the patients that there is a risk of hair shedding within the few initial weeks, but this paradox is actually a good sign and it shows that minoxidil is working. Minoxidil can be applied all over the scalp, however, one should make sure that they do not exceed the limit of 1 ml per day. This is easy to follow because most of the packagings of the solution form of minoxidil come with droppers with markings on them. If you are using the foam formulation of minoxidil, you can use the cap of the spraying bottle as an estimate. If you want to apply minoxidil to your entire scalp, use about 1 capful of minoxidil. If you are targeting one small area of hair loss, you can use about half a cap of minoxidil. If you are planning to apply minoxidil after a hair transplant procedure, make sure that the crusts in the recipient area have fallen off. This usually takes around 10 to 14 days after your hair transplant procedure. Also make sure that you apply minoxidil only in the recipient area and not in the donor area. After applying minoxidil, make sure that you wash your hands immediately after application. If you want to go to bed, make sure that you've waited for about 2 to 4 hours after applying minoxidil, as minoxidil can stain your linens and also rub off against your face or other parts of the body. Lastly, you should wait for about 4 hours before going in for your next shower after applying minoxidil. The effects of minoxidil can be appreciated after a few months of its application. However, for best results, one should continue using minoxidil for about 12 months. If you want to preserve the benefits that you've had due to minoxidil, you should continue applying minoxidil for as long as you can because the effects of minoxidil can be lost quite rapidly and might also lead to hair fall later on. You might end up finding yourself in the same place that you were before starting minoxidil therapy. If you experience headaches, dizziness, or even blurred vision, you should go see your doctor. Many hair loss sufferers have benefited by the use of minoxidil alone. Minoxidil does indeed increase the number of hair in the anagen phase, makes the hair stronger, and it also makes the hair look denser. However, minoxidil does not increase the number of hair on the scalp. For increasing the number of hair on the scalp or in a particular area, you would have to undergo a hair transplant. There's a common misconception that I have discovered amongst my patients that I would want you to know about as it is very interesting. They think that a blue colored container would contain minoxidil specifically for men and a pink colored container would contain minoxidil specifically for women. This is not true. This is a marketing strategy and this segregation of bottles is done specifically by Rogaine. I'm not saying that Rogaine is good or bad. I just want you to know that the blue colored bottle would contain 5% minoxidil and the pink bottle would contain 2% minoxidil. Yes, if I were to prescribe minoxidil to a man, I would prescribe 5% minoxidil. And if I were to prescribe a woman for the first time, I would prescribe 2% minoxidil. However, if the man who is taking 5% minoxidil ends up being allergic to it, I would like to switch him over to a lower concentration of minoxidil, which is 2% minoxidil, which comes in a pink container. And if a woman, on the other hand, is not gaining much from the 2% concentration of minoxidil, I would like her to switch over to the blue bottle, which is 5% minoxidil, which is the higher concentration. To summarize the role of minoxidil in hair loss, it is used for both male as well as female pattern hair loss, which is androgenetic alopecia, the autoimmune form of patchy hair loss, which is alopecia areata, and also before and after a hair transplant procedure for both making the harvesting of grafts easier as well as for reducing the post-operative hair shedding. It is also used in combination with a DHT blocker to improve hair transplant results. Lastly, it is also beneficial in those patients who have chemotherapy induced alopecia and also in those who have traction alopecia. So this was all I had to say about minoxidil. I've tried my best to cover all the important points regarding its application, use, dosage and side effects. However, if you still have any questions to ask, please feel free to comment in the comment section below. Also, if you found this video helpful, please like this video and also subscribe to my YouTube channel, as a hair transplant procedure is incomplete without due research, and I am here to help you understand hair loss and hair restoration in a better way. Thank you for watching.